There is just Slack.
All right, somebody entered. Okay, they're entering.
Okay. Okay.
We good. All right, I'm gonna let them in.
Hey, ladies. How are y'all? How are y'all doing today? Welcome in. Welcome in. We are talking all things anemia today. Are y'all excited? Let me know in the chat if y'all are excited to be here today and learn about anemia and overcoming it with ease. Hey, ladies. I hope y'all Wednesday is going well.
You gotta say, I hope your Wednesday didn't hump too much.
Oh, that's good. That's good. So I hope your Wednesday didn't hump too much. It sounds better coming from you, Dr. Stan. Hey, ladies, where y'all from? Put it in the chat. Where y'all from? Where are y'all from? I'm from Louisiana. It's Mardi Gras time around here. Oh, Houston, I'm sure y'all know about that. Okay, Atlanta, New Jersey, Illinois, Chicago, Illinois. Hey, Amber. Hey, Aura. I see Kimberly Lucas has joined. Welcome in. How are y'all? Keep putting in the chat where y'all from. I'm from Baton Rouge, Louisiana. It's a little hour and a half away from New Orleans. So I know most people know New Orleans, not Baton Rouge. Hello, greetings from Philadelphia. Hi, Miss Pamela. North Carolina, South Carolina. Okay, the Carolinas are here. Alaska.
Alaska.
Wow, Sophia. Welcome in. Welcome in. All right. Who else we got in the chat? In the chat, South Carolina. Hi, Miss Loretta. Okay. International. Mira. Philly. Maryland, Philly. When I think of Philly, I think about Abbott Elementary. I love that show, y'all. Oh my
Such a
God.
good show.
It's
Such a
such
good
a good
show. And
show.
I'm over here waiting, like, okay, where's the episodes? You got me hooked. What's up?
Right. Been waiting.
You know, she did, like, it took her a long time to, like, get that show picked up. And she was, like, about to move back home. And
Really?
then as soon as she was about to, they picked up Abbott. And that was, like, an amazing hit. If y'all
Wow.
haven't checked it out, check it out. It's, like, the perfect little stress reliever, cute show. Make
Mm.
you feel good.
For sure, for sure. It's really, really good. Hey, Stephanie from Marietta, Georgia. I went to Clark Atlanta University, so I'm very familiar with Georgia. All right. Somebody can really say I relate so much to Abbott as an educator. Thank you so much for being an educator. Y'all don't get the respect that
Yes.
y'all deserve and need. We applaud you and we appreciate y'all so much for being educators to the youth as well as even older grown people. So we appreciate you. You're welcome. All right. So we are going to get started. We're going to talk about overcoming anemia with ease. We're going to take those small steps that increase and become big power. So I'm going to introduce our amazing Black Girl Vitamins medical advisor. Her name is Dr. Standifer, but we lovingly call her Dr. Stan. So I'm going to let her introduce herself and get the topic started. Go for it.
Hey, everybody. Dr. Standifer-Barrett. I'm a board certified internal medicine physician. I work primarily in an outpatient setting. So I see a ton of anemia. This is like our bread and butter. So I'm so excited to talk to y'all about it. I am also a clinical professor for medical students, so you might get a little bit of teaching in here too. So my thought is knowledge is power, and I want to, as well as Black Girl Vitamins, help everyone become advocates for themselves. That's the goal here, for you to advocate for yourself. So let's get it.
All right, so we're going to go into our first question. Let me get it going. All right. So, Dr. Stan, what is anemia and what are most of its common causes?
Yeah, so anemia, and I hear this term a lot. People walk around thinking that I'm anemic, I'm anemic. So anemia, by definition, is a blood test that we do, and it's looking at your hemoglobin levels. Hemoglobin is the molecule that the body makes, and it's a part of the red blood cell, and its job is to carry oxygen throughout the entire body. And so normally that hemoglobin level should be greater than 12 in women. And so we call it anemia when it's less than 12. And anemia, I like to kind of put it in three big buckets in terms of causes. Either one, you're losing blood, making you anemic. That's the first one. So blood loss through multiple sources that we'll talk about. Number two, so everything in the body is like building blocks. So you have different building blocks, different pieces that go all together to help the red blood cell flourish. So you can have nutrient deficiencies where you're not getting certain nutrients in that allow that red blood cell to grow and proliferate, and that can also cause anemia. And then there's another bucket, a couple of different other buckets, some genetic causes, and then another bucket is you can have a situation where something's happening in your blood that's causing your hemoglobin or your red blood cells to break apart, and so they're not functional, and then that's another major cause of anemia too. So three major causes.
Gotcha. Thank you. I was one of those girls that was walking around, I'm anemic because that's what I was told because I was always cold. I finally got the test and the doctor was like, "You're not anemic. You're just maybe always cold." So,
Facts, facts. So it's funny how what we perceive anemia as, and I love talking about it when people come in and they tell me that they are. Definitely a great conversation starter.
for sure. Okay. Has anybody in the chat actually had the actual blood testing done that shows that they're actually anemic, or is it like you just thinking that you are because of always being cold? I'm gonna let y'all say that in the chat, but I'm gonna go to the next question for Dr. Stan. Why are Black women at the higher risk of anemia compared to other groups?
So this is a deep question. I think a lot of people, what I see in my office in terms of the cause for anemia, especially in women, particularly Black women, most of us have heavy periods. So when you are in your menstrual cycle phase of your life, or even leading up to menopause, we bleed a lot heavier. A lot of us also tend to have fibroids in our uterus, which bleed. Fibroids are actually tumors in the uterine lining that can bleed. They're responsive to estrogen and they can bleed, and that can cause anemia. And then another big chunk of people, which we don't really talk about a lot, is colon cancer. So colon cancer is really high in the Black community. And as a result, when you have certain colon cancers, they can bleed. And the thing about having a cancer in your colon itself is that, and when you bleed, you might not notice it in your poop. Like some people's poop, when you bleed through your bottom, poop looks black, like the color of my hair black. And whenever you have black poop, that can be a sign of bleeding from your colon somewhere. So because of those two major conditions that we tend to see in the Black community, we're at higher risk for anemia. And I think the even bigger part is that I think women, and then when we talk about anemia, here's the other interesting thing too. Everybody's body has this magical thing I call compensation. So compensation, I think of it as, let's say, just as a Black woman, for example, let's say the world is caving in, you're stressed out. Your body might not perceive stress because maybe you've been stressed for so long. So you might not perceive the stress as someone else who maybe does not have chronic stress perceives it. So it's the same kind of thing with when someone's anemic. Your body might might give you certain signs. It might give you signs where you feel tired, you feel fatigue, you might have some skin changes, you might have hair loss, right? Some people can feel it. Some people get faster heartbeats. Some people even are so anemic where they start to crave things like clay and different things like that. Some people don't feel a thing because they've been anemic for so long. So their bodies have learned to compensate for being anemic. Like they don't know what it's like to not feel tired because they've always been tired. So it's really interesting too how different people and different population groups can perceive their anemia.
Gotcha. So I guess I never correlated your menstrual or things like that to our, even though I knew that it was like blood related, but I never correlated that together. So that's very, very interesting for you to say that, because you think, your menstrual is so natural, like that happens naturally, that has to, happen. So it's like I never correlated it together. So that makes a lot of sense. That makes
I
a
wanted to say something too about that natural piece too. So we always as women, I see people in there say like, oh, my period lasts 10 days. That's just my period, right? I get that conversation a lot. But really, a period shouldn't last that long. So if you're bleeding long for longer periods than like more than 6, 7 days, you need to go get that checked out because that can signal something's going on. Because as it relates to fibroids, is a major cause of blood loss. And this is, I'm happy we talked on this question, so I'll tie it in with the blood loss piece of it, um, you might not feel it. And generally with fibroids too, we don't screen for fibroids, right? You either feel them on exam or someone might get an ultrasound because they're bearing a child. And at that point, we'll take an ultrasound and look at the uterine lining. But for the most part, you don't know you have fibroids until you're like evaluated for it. So you might not know that this heavy bleeding is actually fibroids and not I need to get this checked out in terms of your iron levels and being anemic. So this is why I think it's also underdiagnosed, just going to my initial statement about being compensators, right? We're so used to being tired. We're so used to functioning on E that we don't realize, man, it was my iron this whole time, or something might happen. I see a lot of women come in and they're losing their hair, and that might be a signal to have them ask the question. But unfortunately, checking an iron isn't a part of typical routine lab values. Not every doctor is checking your iron levels. So I think that's another reason why it goes underdiagnosed because systemically, like that's just not a part of it unless the person's having trouble. So I think that's a big reason why it's underdiagnosed and undertreated because A, we perceive our periods being long as normal. B, we function on E for so long. And C, we just don't know what we don't know. We don't feel comfortable sharing or asking those questions.
Yeah, that is really, really good. Ladies, if y'all have any questions, don't hesitate, put them in the chat. We're gonna try to get to as many as we can while we go through all of the questions that we have prepared for y'all. And she might respond to those questions that y'all have throughout the time as well. So we're gonna go to the next question. The next question is, how does anemia impact overall health, including pregnancy and hormonal balance? Sorry, guys.
Yes, this is a great question. So, like I was saying in the beginning, when someone's anemic, you need that hemoglobin molecule. Its job is literally to carry blood throughout the entire body, right? So the heart needs blood flow. Every single organ in the body needs blood. That blood, the major job, what it's doing is it's carrying oxygen to our major organs. So oxygen gets carried on the red blood cell, and that's how every single cell gets the oxygen that it needs. So if you can imagine, if an organ isn't getting the oxygen that it needs, it's going to cause problems. In terms of the biggest thing I see and that people don't really realize is that when you're anemic and your body isn't getting the oxygen that it needs, particularly the heart too, the heart starts working harder. Your heart rate might start beating faster. You might start feeling tired, weak, not like yourself. And when the heart has to work hard for a long period of time, that can actually lead to heart failure. So we want to make sure that we're checking our iron and that we're making sure that we're not anemic because the body has to work 12 billion times harder just to stabilize itself. In terms of pregnancy, Again, oxygen, that's the most critical part, not having enough oxygen to the baby, right? So that can cause preterm delivery, lower birth rates, the mother herself feeling fatigued because you're trying to get iron for yourself and for a growing fetus. So it can make the quality of life during the pregnancy for the mother very difficult. In terms of hormone balance, when we talk about anemia as it relates to either blood loss or loss from low iron levels or even B12 levels, when you don't have enough iron in the body, things like the thyroid hormone starts to become affected. It can throw off the thyroid function. Also, when your body's stressed, so when you don't have enough blood flow or you don't have enough iron or you don't have enough nutrient to make you not anemic anymore, the body actually feels it as a stressor. So the body's now stressed. So when stress levels are high, cortisol level starts to go up. And so as a result of cortisol levels going up, there you have your hormone imbalance there. So whenever the body is stressed, all these different hormones are going to change. And that's why we check, make sure that the anemia is corrected because we know all the downstream effects that it can cause.
Gotcha. So I guess I have a question. So as far as pregnancy goes, and because my sister had a baby and she found out she was anemic then, do you think that some people have already experienced that were already anemic before pregnancy, and they just found out because they were getting all those labs done with like having the baby?
Yes, that happens all the time where I see this a lot where people don't have a PCP, so they're not getting their levels checked. That's the first thing. And then when you're making a baby, it takes a lot on the body, right? And so you need all these nutrients to for the body to actually work. And as a result, this is what causes, I think, a lot of our complications in our women. And again, people attribute, oh, I'm just tired because I'm pregnant, or I'm just tired because I don't feel well. And we just kind of brush our symptoms off. We don't voice them.
Sure. Gotcha. Don't forget to put your questions in the chat, ladies. All right. So the next question is, how do vitamin deficiencies like low iron, B12, and folate, did I say it right,
Mhm.
contribute to anemia?
So this is a great question. So like I said, in our world, there's a billion types of anemias. We just assume it's low iron, but there's a million and one different type. And like I was saying, so let me break it down a little bit further for you. So our bone marrow is where all of our blood cells are made. And so in that making process, like I said, everything is built on building blocks. So your body needs iron to help the hemoglobin molecule build up. It needs B12. B12 is a vitamin. It's a water soluble vitamin. And what it does is between the B12 and the folate. So if you can imagine the red blood cell is like a nice little cell, like a circular cell. And every cell should be a certain size. So when your B12 levels are low and folate levels are low, it can make the red blood cell look really, 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 really big. So then this blood cell is abnormal and it might not be able to function as well as if it was a smaller size. And sometimes too, when the cells are bigger, there's a risk of rupturing. They can break apart, and that can be another form of anemia. But the idea is that you need these different building blocks that help the bone marrow make the red blood cell and make the iron and make all this work together for the anemia not to happen. The other thing that I missed in talking about in terms of the different types, just as it relates to this, is the hemoglobin molecule, which is a part of that red blood cell that carries the oxygen. That molecule, especially in Black people, can be misfolded. Not that it's abnormal, but it can misfold in different ways, and that can also be a cause of anemia in Black people as well. Some of us also too having sickle cell disease, so that's when the cell has an abnormal shape, and that can change too. That's a risk. When you carry sickle cell trait, that can also present with different types of anemias as well. So everything is like a building block onto itself. So it's kind of like when we tell patients, drink your water, your body needs it. It needs these nutrients so that it can actually make and function properly.
That makes sense. We have a question from the chat. The question is, how does our ferritin levels relate to low iron levels?
Yes. So Ferritin is like a storage molecule. It's kind of like if you can imagine it's your pantry where you keep all your iron, your stored iron. So ferritin, so you have iron, which we check, which is kind of like the just straight up iron serum. And then you have iron needs to be on this carrier molecule. And then when it's low, it'll go to the ferritin storage to get more. The thing with ferritin though, I'm gonna try not to nerd out too much on y'all, but the thing with ferritin is, if you can imagine, it's a storage molecule. When we're sick, when we don't feel well, bacteria and viruses like to eat iron. It's a food source for bacteria and viruses. So when we're sick, that's why we don't typically check iron levels when you're sick, because the body is going to try to protect as much iron as it can when you're sick because it knows that bacteria and viruses like to eat the iron. So we call ferritin like an acute phase reactant, meaning like it can change depending on where you are. If you're ill, if you have a lot of chronic conditions, it can definitely have a different value depending on where you are in your illness. So we use ferritin to see if a person has enough storage. And we call it like really severe iron deficiency anemia when your ferritin is low, meaning you have no storage and you have no iron floating around in your blood.
Wow, you mean to tell me that the viruses is eating iron?
Yep, viruses and bacteria love iron. It's a
Wow.
nutrient, right? They need it. They want to thrive and survive. So they're like, well, I'm gonna just take this person's. I'm gonna take yours, Deja. I'm gonna take yours. So that's kind of how it works.
Wow. Someone says the volume seems low. Okay, we're gonna work on volume for you all. We have Amira who's a part of our team, so we're gonna get her to work on that volume. In the meantime, I'll try to speak louder and we'll get Dr. Stan to speak a little louder as well. All righty. All right, so we're gonna go to the next question. What are the biggest risk factors for developing anemia due to nutrient deficiencies?
So the biggest risk factor is what we're putting in our mouths. So we say this a lot at BGV, where we just know our foods don't come equipped with everything we need in them, whether it's the types of food that they're putting out or the types of food choices that we make. So if you're eating a diet high in processed foods, that diet is not going to allow you to get the nutrients that you need, and that can cause different nutritional deficiencies. B12, we find that in a lot of our veggies and our red meat. So a lot of the people I care for who are vegans or vegetarians, I'll have them actually supplement with B12 because I know they're not getting enough through their diet. Same thing with iron. You can get it through some of your leafy green vegetables, but it's really highly concentrated in a lot of our red meats. And so either if a person it doesn't eat red meat or they can't, or I'm not a really big red meat eater, I'll have to supplement or get it through other sources. Like tofu is also a really good source of iron as well. So it's definitely all about what we're eating. Like sometimes I can get a person to not require to take an additional supplement longer if I can encourage them to get it through their diet. But like I said, it's just so hard in the US with our food being so processed. It's hard to say what we're getting, how much we're getting, and that's why we heavily rely on supplementation.
Yeah, supplementation is definitely important, especially like she said in the States. We have a question from the chat. How can you, sorry, it went up on me. How can you keep your iron levels normal if you have multiple autoimmune conditions?
That's a really good question. So definitely depends on the autoimmune condition. For the people I care for that have autoimmune conditions, I'll check their levels regularly just to make sure I'm staying on top. Because some of these nutrients, especially iron, you don't want to take too much of it. You want to make sure that someone's monitoring your levels because iron actually the body will hang on to iron. So if you take too much, it can start to store in different parts of the body, like the liver, for example. It can store in that liver, and that can cause a bunch of different problems too. So there's like this fine balance of replenishing iron, checking iron, and making sure that the levels are tight. Definitely, if you have a situation where you know you are a heavy bleeder and you have fibroids, definitely need to take the iron, need to get it checked to make sure you're good.
Okay, this question is, how can someone determine if their anemia is caused by diet or underlying health conditions?
So we do a workup. So one of the first things, if I have a person that's anemic, one of the first things I'm doing is I'm checking their iron levels, I'm checking their B12, I'm checking their folic acid levels. The other thing with irons is I know we're talking about that a lot. There's a condition called celiac disease or gluten intolerance where your body literally can't absorb iron. So there's those situations where when you take an iron supplement orally, if your gut system has trouble, because you absorb iron through your intestine. And so if your intestine has an issue with absorbing the iron itself, namely from a condition like celiac disease, you won't be able to, even if you take 1,000,000,001 iron supplements, it's not going to do anything to your iron level. So we also make sure we're screening for celiac disease too. So if y'all iron deficient and your doctor told you you're iron deficient, and sometimes bread and pasta hurt your stomach, ask your doctor to screen you for celiac disease because that's definitely a cause. And what we do is we have them stop taking in gluten, and they're able to recover their intestinal lining a little bit better. But we check the levels. That's the first thing. A lot of times, what I'll say, if a person does come back low iron and they tell me, no, Dr. Standifer, I'm not a heavy bleeder. No, I'm not bleeding anywhere, then I'll know it must be from their diet. That's generally it's kind of a process of elimination. Like we ask, are you bleeding? Do you have any other issues? And then we're able to procure, especially if we're able to supplement and it comes up, we know it's from the diet versus some other exogenous illness.
Gotcha. Okay. I have another question from the chat. Someone asked, how can you not absorb iron? Is that the bacteria answer?
Yep, that's the intestinal because you absorb it through your small intestine, like the first part of it. And so if there's an issue with your intestine for a myriad of different reasons, there could be a problem with absorption, excuse me.
Gotcha. And one more question from the chat. How can you test for different anemia?
Yep. So when we talked about when I was going back, so if a person comes in there anemic, I'm checking iron, I'm checking B12, I'm checking folic acid. I'll get a test called a hemoglobin electrophoresis. So like I was saying, in Black people, we have different conditions. They're called thalassemias, not to get nerd out on y'all, but that hemoglobin molecule is like folded it kind of like this. And so sometimes it could be misfolded, and that might not be a harm to a person, but when we look at the levels, it'll show some form of anemia, and that could be from the hemoglobin molecule being misfolded. So we'll screen for hemoglobin electrophoresis. If a person's anemic and let's say their eyes are yellow, right? If your eyes are yellow, you're anemic. We think about conditions where your red blood cells are bursting, like I was saying before, and that's causing this molecule called bilirubin to build up in the system. So we're screening for all these different conditions when a person is anemic. And then depending on the size of the red blood cell, believe it or not, the size of the red blood cell can tell you a lot about things. So case in point, for example, I see people and I'll say, "Hey, do you drink alcohol?" No, I don't drink alcohol. Okay. So believe it or not, alcohol, when you drink alcohol, remember when I told you guys that the bone marrow's job is to make red blood cells, white blood cells, all your cells of your body. Alcohol actually suppresses growth at the level of the bone marrow so that people can also develop anemias from drinking alcohol in excess. So you can definitely notice different cell changes with different things we're doing to ourselves that we might not know about.
Gotcha. Oh, wow. I wanted to say this earlier. It's okay for you to nerd out on us because we want to know. We want to know. Y'all tell her in the chat we want to know the information. It's okay for her to nerd out on us. Okay, so we're gonna go to the next question on the slide. What are the most common symptoms of anemia and how do they affect daily life, energy, and mental clarity? I think you kind of went through that, but you can touch on it a little bit and then we'll go to the next question.
Yep, so fatigue, we call it paler, where you kind of look more pale. Even as a Black girl, I can see pale faces on people. Hair loss is a big one. What else? Sometimes when you're so iron deficient, it can cause a bunch of other problems to happen. So low thyroid function, it can happen when you're anemic, so you feel weak, that tired feeling, dragging, again, craving things, sand, dirt, red meat, ice, all these different things can is what anemia can look like. And some people unfortunately don't feel a single thing, which is I think are the scariest ones. So even if you don't feel it, just check your levels.
All right. So the next question is, what are the best food sources and supplements for iron, B12, and folate, and how can Black women improve absorption? I think you kind of went through that as well.
Yep. Yep.
So I think we have a question from the chat. So we'll go to that question. The question is, should you take iron supplements every day?
So I tell my the people I care for to try them every other day. And the reason is because certain supplements, especially iron, can cause constipation. And studies show that you this taking it every day and taking it every other day, there's no difference in absorption. So I tell people to do that. I also know that when you take iron with vitamin C or like a glass of orange juice, that vitamin C actually helps it absorb better in terms of the improving absorption question. But I usually counsel people to take it every other day. Just to help reduce different constipation symptoms. Now, different iron supplements I've seen some variations can cause more constipation than others. And it's also, of course, about your body too. Um, and then was it, yeah, I think that was all that question. Yep. Yeah.
Yeah, that was all that question. Now I'm going to go to the next question on the slide. What should people know about iron supplements, potential side effects, and choosing the right ones?
Yes. So monitor, monitor, monitor. So some people um prefer not to go to the doctor. You know, that's their own business. But if you're taking something like iron, like I said, the body it can't break it down, so it stores it. Like I said, you got this big pantry. And so you don't want to take too much of it because then you can get iron overload, iron filling up these different organs like the liver. So now the liver is filled with iron and it's not working right. So you don't want to take too much because you can harm other organs when you're overload in iron. And then choosing the right one definitely depends on your side effect profile. Like there's some people who, a really common iron derivative is ferrous sulfate because it's cheap. But that one causes a lot of constipation. There's different elixirs for iron that can help. Our gummy, from what I hear, doesn't cause constipation. It's easier on the stomach. So it just definitely depends on like your body and like what form of iron you're getting.
I feel like you kind of went through this question as well, so I'll ask the question. Why do we crave this ice whenever we're, anemic or low in iron? What is that, I guess, correlation?
Yeah, so it's called pica. I'm not exactly sure like what the physiology behind like why you crave it. I think the thing is like even when people are trying to lose weight, right? You feel hunger. Sometimes when you're thirsty, your body doesn't differentiate. No, you're actually just need water. Don't put the hamburger down. It just sends a signal to drive you to put something in your mouth. It's desperate at this point. Put something in the mouth to get me something. You know what I'm saying? And the most interesting part, my best friend, she deals with anemia. Shout out to you, bestie. You know who you are. She deals with anemia, and she tells me when she is anemic and she craves ice, she can't even feel the cold on her teeth. So your body is desperately trying to get some type of nutrient in to replenish itself. It's a signal, it's a stress signal. And so as a result, she'll tell me like when she gets her iron levels replenished, she won't crave the ice. And then she tried to eat a piece and her teeth were cold. Versus when she's so like out of the works with her levels, she doesn't feel it. It's so interesting. But I think it's a stress signal and your body's trying to get something in it to replenish those levels.
Gotcha. Hey, bestie. Okay. So I'm gonna ask a few more of the questions that were in the chat, and then we'll get some questions from the audience. So someone asked if sorry, how does being an alpha I might be butchering this.
Thalassemia.
Yes, I'm butchering that scientific term, but carrier impact a person who is anemic.
Yeah, so thalassemia is a form of anemia. And like I was saying, that hemoglobin molecule, it has two alphas, two betas. Now I'm going all the way back to first year of med school, but two alphas, two betas, and then they can become misfolded. So the body, interestingly, the body is extremely protective. I'm gonna put y'all on game on something. As it relates to sickle cell disease, which is very common in Black people, the body, what it did was how sickle cell disease even came about was a long time ago back in Africa, there were these different flies that would cause different diseases. And as a result, to not get these diseases, like malaria, for example, the body would actually change the red blood cell because malaria is a blood illness where a parasite can actually get into the red blood cell, cause a bunch of problems. And so as a result, the body over time started to change the red blood cell so that the malaria would not affect it. And as a result of it, as a result of the body trying to protect itself from malaria, this is where sickle cell disease has come from. So a lot of these different folding changes that happen in people are a result of the body trying to fight off some illness from 20 years ago. Because like I said in the beginning, the body is like a major compensator. The body tries to heal itself, it tries to fix itself, it tries to use what it has to protect itself. And so when it comes to different things like alpha, so there's two different types of alpha thalassemias. One you don't live with, like you won't make it out your mother's belly if you have one of the alpha thalassemias. But the second one is more so something that we know people have. So we might see smaller red blood cells. We'll check their levels more frequently. It's important to know if you're having alpha thalassemia versus iron deficiency because they can look similar when we're evaluating the labs. So I have people who didn't know they had alpha thalassemia, which is again a misfolded hemoglobin molecule, and they were told by someone to just take iron when that's not the case. Like taking additional iron does not help the thalassemia. So when I see someone, I try to differentiate, which is when I was saying getting a hemoglobin electrophoresis so I know exactly what I'm dealing with instead of just assuming it's from iron.
Gotcha. So now we're gonna go to the audience questions. You all can raise your hand and I'll say the person's name and then y'all can answer the extra question. Sorry, extra question. Dr. Stan will answer and then I'll call on the next person. So raise your hands if y'all want a one-on-one call. Like I said last time in our last one, you're getting a free doctor visit right now from Dr. Stan and she's amazing. Okay, so I'm not sure of your name. I am going to, it says iPhone 16 Pro Max. You have the red shirt on.
That's me. I'm sorry. My name is Lisa. How are you?
Good,
Hey,
Lisa. Doing
Lisa.
well. How are
Hi.
you?
Okay, so my question is,
I think you went out, Lisa. Can you hear
um,
Dr. Stan? Oh, there you
can you
are.
hear me now?
Yep.
Okay. I realized when I stopped taking my iron pills, um my levels immediately goes extremely low to the point where I get dizzy, I have headaches, chest pains if I'm just walking less than a block, and fatigue real fast. Um, and no matter how much of when I am taking it, no matter how much of the iron I take, my levels they never go above an eight. And my doctors can't tell me why, and I don't know why. But as far as I know, as long as I've known myself, I've been anemic.
So have you seen like a hematologist before?
Yes, yes.
Okay. Okay.
I've had two blood transfusions and iron transfusions.
Wow. And you've
Yeah.
had colonoscopy, you've done that, no issues.
No, I haven't done I've never done a colonoscopy. Colonoscopy.
That would be a next thing I would check. And the reason is because if you've seen a hematologist, you
Mm-hmm.
don't have anything there. If you don't have any, so the other thing I didn't mention either, so certain chronic conditions
Uh-huh.
will cause a person to appear anemic. We call it anemia of chronic disease because the body actually, because it's dealing with all these other chronic illnesses, will actually suppress the hemoglobin molecule. So that's another facet, especially with kidney disease. We see it a lot with kidney disease, multiple myeloma. So it's a bunch of different conditions that can cause anemia. So definitely, I would have make sure your doctors checked you for myeloma, chronic kidney disease. I would look into getting a colonoscopy because sometimes we can have when you it sounds like you have iron loss if you're taking iron and you stop and the levels go down. I would
Yes.
look into is this iron loss coming from some bleeding somewhere? So another thing we do too, a lot of people, again, going back to fibroids, might have a lot of menstrual cramping or just pain where we're taking a lot of Motrin. Motrin,
Yes.
when you take it in excess, can actually cause ulcers, which then cause slow bleeding from the stomach into the gut, and that too can cause anemia or low iron levels. So I would start with I would ask your doctor to send you for a colonoscopy to make
Mhm.
sure you don't have any polyps that are bleeding that you just don't know about. And then
Okay.
I will also have your doctor check you for celiac disease too.
Celiac. Okay. Thank you.
You're welcome.
Thanks for asking your question. Now we'll have LaShawn.
Hello.
Hey.
Hi. Thank you for having the call. I appreciate this very much. I just wanted to ask about the ferritin. Uh, if it's too high, what is it that I need to do in order to get it to a decent level? Like mine right now is 293.
So I would say the next question then becomes, I don't know if your whole medical conditions, but I would talk to your doctor about is there, because like I was telling you, a ferritin, we don't really target a ferritin level. If a
Mm-hmm.
person's iron levels are normal and the ferritin is high, we don't really do a whole lot about it. There are other conditions where you might see very high iron levels and high ferritin levels. And then we start thinking about conditions called hemochromatosis, which is a genetic
Mm-hmm.
condition that can damage the liver. So I would look into that, make sure that's not a situation. And then also, like I was saying, when you're stressed and when you're sick, ferritin levels can go up and down. So looking at other reasons, other than just iron itself, like is there other medical conditions going on? Are you ill? Did you have COVID anytime? Did you have any virus at any point? All these can fluctuate the ferritin level.
I see. Okay. All right. That's perfect. Thank you so much.
You're welcome.
Thank you, LaShawn. Now we'll have Sarah Jenkins. I don't know if I said it right. I hope I did.
I think you did. Yeah, it's pronounced Kira. Nice to meet you, ladies.
Nice to meet you.
So, I'm 45 years old. I suffer from fibroids. My iron dropped tremendously. The doctor wanted me to go on iron medication, but it was causing a lot of constipation. So I tried your vitamins and they worked. But my question is, should I still continue to take them daily or just maybe every other day? I'm just concerned. I don't want my iron to drop lower because I still do have the heavy bleeding from the fibroids. I don't have pain or anything, but it's just the heavy bleeding.
I would say, and I'm real big on this, is definitely talk to your doctor about it.
Mm-hmm.
I agree. As long as you're bleeding heavy, your
Mm-hmm.
iron levels are going to go down. So while you're still menstruating and things, I would definitely encourage you to continue to take the iron with the caveat that your doctor's checking your levels so that they're not going too high, too low. Because like I said, you can also get iron from food. So you might have a really iron-rich meal for a couple of days and then you're taking this supplement. So making sure that you're not going too high is also, it's kind of like a really fine balance. But
Mm-hmm.
definitely every other day is perfectly fine. And then also making sure that, like I said, when you're bleeding heavy, that you take it. And then when you go into, because you're right at the age when we start seeing perimenopausal transitions where you might skip a month, you might skip 2 months, you might have two periods in 1 month. So definitely adjusting your iron supplement to your body changing too.
Okay. Thank you.
You're welcome.
All right, Miss Lisa Sutton.
Hi everyone. I'm so excited that you actually had this call tonight. It popped up and I was like, wait a minute, let me join on right now. So I'm
Thanks for
excited.
joining us.
Absolutely. Thanks for having it. I have a two-part. One, does a partial gastrectomy impact iron absorption? Um, and the sickle cell trait impact iron absorption. I was told that I had sickle cell. I was born with, I guess, sickle cell trait, not sickle cell disease, but sickle cell trait. Um, and then when I was around 17, I had a partial gastrectomy where they found a tumor the size of a golf ball on my stomach, but it was benign. So they had to take the tumor in one third of my stomach. And I had anemia when I was younger, but now I still really, really have it. I've had IV, was that the infusions, which I'm highly allergic to. I cannot have it. It almost took me out.
Yeah.
Um, and I've had multiple blood transfusions, like multiple. So I started taking the iron pills, the black girl vitamin iron pills, to see if this will actually help because anything else kind of like irritates my stomach. I've tried it with orange juice and it just I either get extremely constipated or like it irritates my stomach so bad that I can't take it. But I haven't had that so far with the black girl with the gummies. So
Perfect.
I was
Perfect.
just wondering if those two things had like a huge impact on and long term on iron absorption.
Definitely, because with the stomach's job is to break down food so that the small intestine can then absorb the nutrients from it, right? So when we talk about removing a portion of the stomach, like I told you guys, the iron is actually absorbed in the intestine, so past the stomach. But you need the food to be broken down. There's a bunch of different acids that are released, different cascade in the stomach in terms of the breaking the food down part. So I would argue that it's possible that gastrectomy can cause deficiency, maybe not directly, but indirectly as a way of the food not being able to potentially break down as well to get to the small intestine for it to become absorbed. So that's the first part of it. I would definitely, if I were you, having your doctor check your iron levels quarterly to make sure that the levels aren't too high, too low, making sure you're getting what you need. Because I have some people, especially people who've had bariatric Roux-en-Y's where they get the weight loss surgery there. I'll have to actually send them to hematology for iron transfusions because they're not absorbing it as much. Um, and then in terms of your second question, I'm sorry, sickle cell disease trait. Sickle cell disease trait is more about that hemoglobin molecule being misfolded and less so about low iron. So always, always, always have your iron levels checked. You want an iron level, a TIBC, and a ferritin level. And those should be done in your situation, I would say quarterly.
Thank you so much. Appreciate
You're
that.
welcome.
Now, Miss Ariel.
Hi, Queens. I'm so excited to catch one of these lives. Um, you might have covered some of this as you were answering some of the other ladies on the call. I've had low iron since I can remember pills to infusions. As of last year, I had to have 3 rounds of infusions. So it's almost like every 4 months I'm dropping. And I've seen a hematologist. We've gone through my blood history, my family's blood history. I have had a colonoscopy. They can't find anything. Um, and I can feel myself dropping again. So I just had my most recent one in, I believe, November, and it's March. And I'm like craving the ice. I'm tired. I can feel my nails changing, like all the symptoms, right? So the only thing that I know that I have is I have heavy cycles. They last 7 days, but I have no history of fibroids. I've had ultrasounds, they've done all the workups, can't find anything. Um, and the only other symptom outside of the heavy bleeding would be just these sharp pains I get in my stomach often, but there's nothing there. So do you think that there's anything else that we should possibly test for that we're just missing?
Yeah, so in that type of situation with the heavy bleeding without any other acute signs, I would look at things like there's actually one of the most common blood factor issues is called von Willebrand factor deficiency. I don't know if your hematologist checked you for that, but that could be a driver as to why you're bleeding heavy. I see it a lot, in our office, we presume fibroids, but you can have a lot of different issues, especially if the uterine cavity is okay, the gynecologist told you everything checked out. I would look into different blood coagulation issues like von Willebrand factor, maybe some factor deficiencies. Um, there's clotting numbers that can be done too. I would look into that. I'm not sure if you said you had celiac disease ruled out, but that's also something that's very common. And some people don't even feel it, right? Some people, I have a person actually who her first symptom for celiac disease was just a rash. So I would look into the bleeding cascade to make sure nothing's going on with that. I don't know if the hematologist did that or not, but I would definitely check into it and see further.
Yes. So yes, we checked all of the like the clotting factors. And I believe I was tested for, I don't know how to pronounce it, the vom.
The von Willebrand.
Yes. And she said no, that I did not have that, so she wasn't sure. So basically we just did the infusions and she was like, come back and see me if you get low. So I'm
Got
like,
you.
okay.
And then
But
the only other thing that is terribly invasive is like a bone marrow aspirate to check.
ooh,
But that's so painful where you actually look at the bone marrow itself and check different markers to see if it's actually doing what it's supposed to do too. So that's another, but it's very expensive and it's painful. And I think a lot of times in medicine, we know that there is an option available, but then the question is, do I want to put my patient through this? Is it going to yield us a benefit? And things like that. And also myeloma as well. That's one of those little conditions that people don't know about. But if it sounds like your hematologist did the entire workup, so I'm gonna think on it, and then you can put your information in here. And if I think of something else, we can touch base with you.
okay, sounds good. Thank you so much.
Thank you, Ariel. We're gonna have our last question with Christina. I think you're still on mute, Christina.
Okay, now can you hear me?
Yes, we
Yep.
can hear you now.
Okay. Hope you ladies are having a good day. I'm glad y'all are doing this, and I'm glad that I was walking at the track when I saw this come on. Um, but what I want to ask is, what I want to say is, I have been getting iron infusions by IV for like the last 10 years now, and I get them like about every 4 months. Every 4 or 5 months. Like I'm low right now. I did order some gummies and I'm waiting on them. But 2 years ago, my hemoglobin doctor, my blood doctor, had me tested to see if I was actually like he felt like we've been doing these infusions so long. Let's see if you can absorb iron pills. Why can we never try that? Which we did. I did at another doctor in Dallas, Texas years ago, and I would get really sick. So we learned that I do not absorb iron pills. So I want to know, will I be able to absorb the gummies?
I think the best way is to honestly do a trial error and see. Try them out, see, because everybody's intestine is different, and then the formulation is a little bit different than, let's say, like the ferrous sulfate tablets that we give over the counter and things like that. But the best way for you to do it is just to try it and see. Take
Try it
some,
and see.
try
Okay.
it and see. Take some, give it a couple of months. A, see how you feel, and then B, just have your doc check the levels and just see if it works for you. Because I have some people who can't take a single thing, and then I'm like, okay, well, go see Black Girl Vitamins. We've tried this, and this one is better for people. So it definitely depends on your body and how your
Okay.
body wants to respond to it. But I'm sorry you're
Okay.
going through that. That's heavy. And thank you for
Yeah.
sharing.
Um, and one of the most stressful thing with me is my doctor, I'm hanging in there with him, but he makes me feel sad when he tells me, okay, he feels like I should have gotten a hysterectomy in 2020, but my OBGYN doctor felt like there's no reason to get, even though you don't have any kids and you're not going to have any kids, I don't see any reason to give you a hysterectomy. She was kind of like, that's just what the men think. Well, he says that I should have gotten a hysterectomy because I'm going to have congestive heart failure.
From
And
your iron being so low and your body working so hard.
yeah, he said, you're just giving yourself congestive heart failure. So now I'm feeling like, should I have gotten the hysterectomy? Like, I don't know. I mean,
I would get a second opinion. Always get a second opinion from someone else. I mean, definitely one, you've been dealing with this for some time, so make sure someone's checking a heart ultrasound or echocardiogram where we can actually
okay,
check the structural integrity of your heart, and then you can wipe off the congestive heart failure fear because you'll actually have a test that shows where you are in terms of status, and then get a different
okay.
opinion. I think if
That's
your
what I'm gonna do. 'Cause I
gynecologist
don't want
says you,
to.
what'd you
Hmm.
say?
I am. I don't really feel like. I mean, yeah, my cycles. Like, I thought I was going through menopause. But I guess I'm not. I thought I was going through perimenopause, but I've been coming on my cycles now consecutively for the last 4 months. I'm hoping she don't come next month. But I mean, he
And
said that I need to stop bleeding.
you could still very well be in perimenopause and have cycles monthly. There's different phases of perimenopause where you might have a cycle every month, then it might skip and go every other month, then it might change and say, okay, I'm coming for 12 months now. I have people
Oh
who have
wow.
I have people who literally go, I saw someone who had cycles straight up, no cycles for 11 months straight. And then
Hmm.
month 12, her cycle came. So she had to start all over again. So it's definitely a transition and it looks different in everybody. But I
Okay.
would say definitely talk to another doctor. No doctor should be saying that unless they've like screened you for it. Like if you've never had
Right.
a heart ultrasound, I would need to
Never.
hear someone with that. So I would ask for one of those if he's so concerned about heart failure, will say, well, can I get a heart ultrasound to make sure I'm not in heart
To
failure,
make sure I'm
not at
okay.
risk for it? Yeah,
Yeah. Okay,
definitely.
I'm gonna do that. I'm
Do
gonna
it.
definitely do that.
Yeah.
Well, I'm looking forward to getting my products. I did the B12. I did so much because I'm trying to feed the blood in every way I can, and I do eat
Good,
a lot of greens, um, juice a lot of kale and spinaches and all that. I'm trying everything.
good, good, good.
But thank you.
You're welcome. Happy to help.
You're doing so
Thank you.
well, Christina.
Oh, thank you.
You're welcome. You're so welcome. Thank you for asking your question.
Hey, thank y'all for being here for us.
Of
No
course.
problem at all. You guys, we will be sharing this recording on our YouTube channel. So tune into our YouTube channel. Amir will put that YouTube link in our chat. And so now we have a big surprise for y'all. Are y'all ready for the surprise? Put a thumbs up in the chat if y'all ready for a surprise. Do I see some thumbs going up? Y'all don't like surprises? All right. Oh, okay. I see him coming. I see him coming. All right. Okay, we have a special. This is for our iron gummies. It's really for all of our gummies. We have 20% off of our products if you use the code EASE20. 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 So for 20% off, EASE20 on all of our products. I know that we're all on this call for anemic education and everything. So those iron supplements will definitely help you with that. Happy Women's History Month. Women are so powerful. We are so amazing. And I am so grateful for you all being on this webinar. Thank you, Dr. Stan, for nerding out and giving us all the information that we need to be able
Always.
to overcome anemia.
And you know the best part? I feel like I hope y'all walk away empowered. I hope you feel like now you can ask more questions. You feel like you can be an advocate for yourself. Let's just work through this thing called life together, y'all.
Yes. Thank you. Thank you. Thank you. Thank y'all so much for joining us. We truly appreciate you. We have some more webinars planned for this month for Women's History Month. It's going to be amazing. We do these every month. So tune in. We have 3 amazing Black Girl Vitamins medical advisors, including Dr. Stan. So y'all just tune in, and we love and appreciate you all. Thank you for being a part of our sisterhood and our community. I hope y'all have an amazing week. And I hope, what is it, Wednesday didn't hump too much for you. But Have a great rest of y'all week. Bye, y'all.